Thank you so much for joining us today. We're so excited to have you here. Can you go ahead and get us started with an introduction?
Sure. I'm so excited to be here and join y'all for Career Day. I went to Richards actually back in the 90s. So this is exciting for me to be able to be back with y'all. But my name's Julie King, and I'm a physical therapist here locally in Columbus with St. Francis. And I'm at our Main Street Village location, which is one of our outpatient clinics that we have.
Perfect. And how long have you been there?
I have been with St. Francis about 8 years. Before that, I was with another at another hospital for about 6 years. So I've been a physical therapist I'm in my 14th year of practice.
Awesome. Congratulations.
Thank you.
Perfect. So my first question is, what type of education or training is required for your career?
Absolutely. That's a great question. So initially, you'll want to have some sort of an undergrad degree. It really doesn't matter too much what your undergrad degree is in, but my degree was in rehabilitation services education. But a lot of times people will do exercise science, kinesiology, really any of the sciences. We've even had people with biology degrees, things like that. And then after undergrad, you go to physical therapy school, which is a 3-year program. And when you leave there, you have a clinical doctorate.
Perfect. That's awesome. And where did you go for physical therapy school and also your undergraduate degree?
I did an undergraduate degree at Auburn, and then for physical therapy school, I went to Belmont University in Nashville, Tennessee.
Perfect. So what led you to this career?
Well, I tell you, a lot of times people will say, oh, I've had to go to physical therapy. I've had a parent that's had to go to physical therapy, something like that. But to tell you the truth, I thought it looked fun. And that has proven to be true.
That's good news to hear. So our kids that are interested in this, they know it's going to be fun. And that's the thing we've been talking about, turning their passions or their interests or things they like to do or things that they think are fun into their career, so it doesn't feel like you're working. So that's perfect. You're just going there to have fun.
Well, the thing is too, well, I'm sorry to interrupt, but the thing too is every day is a little bit different. And so it's not one of those jobs where you're doing the same thing day after day, hour after hour, every day, depending on what patients you see and what you're treating them for. It can be completely different from any other day you've ever experienced. And that's one of the things that I really like about it too.
That's awesome. And that leads us into our next question. I know you just touched on it, but what does a typical day consist of in your field?
Well, I tell you, days are long, but they're fun and they're good. But being in the outpatient setting, what that means is that people come to me. There are therapists that work in the hospital. There are therapists that go to people's homes. There are therapists in the schools, those sorts of things. But patients come to me. And so our days typically, our first patient is usually about 8 o'clock. And then our last one, we usually finish up about 5:30. So it's a full day of people coming in, coming out, seeing them for whatever we're treating them for, whether it's an injury, if they've had surgery, if they've had some unfortunate problem like a stroke or something like that. It really just kind of depends, but typically we'll see anywhere from 10 to 15 people a day, and it just goes right on along. It's pretty fast paced.
Perfect. And I guess I should have asked you this in the beginning, but let me jump back. What exactly is a physical therapist?
Absolutely. And that's a great question. And really, like what I just touched on, a physical therapist is someone who helps people recover, whether it's from surgery, whether it's an injury. Sometimes, I mean, we do have therapists that work with children who are born with disabilities and need help learning how to walk. And we just really do all sorts of things. We have ones that treat swelling, ones that treat athletes, one that treats older individuals and work on balance, work on strength, work on all sorts of different things. So there's a wide variety of things available.
Perfect. So that adds to that whole difference going in and different things back to back. I love it. So what do you enjoy most about your career?
Well, there are two things that I really like. The first one is the people that I work with. We all function as a team, and we work not only with each other as therapists, but also with an occupational therapist who she is trained in the arm and the upper extremity, and she does a lot of things with like writing and helping people learn how to get dressed again, how to feed themselves. We also have a speech therapist here at my clinic. And so getting to work with all of those different disciplines is exciting because we can see progress all the way around. But then we also have to have good relationships with doctors, the people at the hospital, the case managers who are setting people up for therapy when they're leaving the hospital, those sorts of things. So it's a pretty big team that we get to work with. And so I really enjoy that. And then really the other thing too is just knowing that you have made an impact in somebody's life. Because a lot of times, people will come in, they've had a really bad injury or something that has happened. And for instance, they can't walk, they come in a wheelchair. And so we work with them, we get their strength back, we get their endurance back, we work with them on their balance, and then they walk out. And so not that happens very quickly, but after several weeks, sometimes months, that is just so rewarding to know that you have impacted somebody's life.
Yes, that's beautiful, Dr. King. Awesome. So what are some challenges that you faced in your role?
Well, I tell you, the thing is that time management is always pretty tough, because there are sometimes when okay, I've got 45 minutes with this person and you want to just keep going, but you also got somebody else that's coming in waiting to see you as well. So it's hard when you are making progress and forward momentum to have to be like, okay, let's stop, let's take a break, we'll pick back up here next time, those sorts of things. And really too, healthcare is just a very dynamic field right now. And so there are a lot of different changes, both with insurance and with just the types of surgeries that people are doing. COVID opened a whole new ball game as far as healthcare goes, which I'm sure everybody knows about, but it's just, there's a lot of change. And so it's very quick, and you have to kind of keep up with it and be able to adjust and be very flexible.
Perfect. So how do you see your career evolving in the next 10 years?
Well, I don't think it's going to get any slower, that's for sure. We have all of these people who are becoming what we term elderly. Don't tell anybody I said that, but people that are, from 60 on, that are part of the baby boomer generation, and they are going to require more physical therapy services. And to help them just maintain their mobility and to be safe in their day-to-day activities. And meanwhile, you're still going to have people that have to have surgery or they get injured, and children, and it's not going to stop, because people and humans are not going to stop either. So it's going to continue to be fast-paced. Continue to do really more of the same, and we'll just kind of see how technology evolves, because there's always new approaches, new equipment, new research studies that have been done that will help kind of shape the way that we treat people in the future as well, depending on the progress and what the evidence shows.
Perfect. So what kind of person do you think is most successful in your field?
Well, you've got to like to be around people, and you've got to like to talk, because as people are coming in and out, they want to know all about you. You want to know about them. So being able to communicate both verbally and written is very, very important, because with every treatment that we see, we also have to write a corresponding note to document what we've done and to demonstrate why they need to continue to keep coming to therapy. So you've got to like to be around people. You've got to be able to be pretty flexible, because the days don't always go the way you think they are. And really just being a people person and a good communicator, and just really attention to detail too. So it can be open to a wide variety of people.
Perfect. What does communication look like in your field?
Well, all of our documentation is done on the computer. It's all electronic. Back when I started 14 years ago, we were handwriting notes, but we don't have to do that anymore. So we always have a laptop with us, and all of our, exercises and things that we do with the patients are there. And so we do, treat our patients, and then we come in and write a note, and it can take anywhere from 10 to 15 minutes. to write a good note. And there's specific things that you have to put in there. So it does sometimes take a little bit longer. So written communication is important, but then you've also not only, like I said, just talking with people, but you've also got to be able to communicate with the physicians and the other medical professionals in the field with whom you're sharing the patient. So it's a lot of electronic, but it's a lot of talking too.
And you just touched on this with their charting and everything, but what other kind of technology do you use in your field?
Well, we really kind of depending on the equipment, a lot of our stuff is not necessarily high tech. You'll see these things on TV that are pretty high tech, people in harnesses and things like that. And at my clinic, we do not have that. So we are more kind of hands-on, like actually touching the people, working with them. So technology can be a lot of different things. Like in the speech therapy world, they can create boards that help people communicate. And so it really just kind of depends based on the patient.
Perfect. So do you have any classes that you would recommend for our students in middle school or high school to take if they're interested in your career or one similar?
Absolutely. I think the science classes are super, super important, whether it's biology, anatomy, physics. We do in undergrad have to take chemistry as well. I don't feel like I use that quite as much, but physics, definitely knowing how things work. Anatomy, having to know the body, because we treat really anything from head to toe. So we've got to be able to know what we're dealing with. And we've got to know the different lifespans too, from a baby to an elderly person, to be able to treat them as well. So really heavy on anatomy and sciences. Math is also helpful, but with what you typically get in school is pretty good. But anatomy is a good one, and then on into college, like kinesiology, things like that as well.
Perfect. Awesome. Do you have any last words of wisdom for our students here or advice for our students here at Richards?
I just thank y'all for letting me be a part of it, and y'all just keep working hard. And I know the last couple of years have been different, but I know the types of teachers y'all have there at Richards and what they're helping y'all to learn and to achieve. Just keep after it, because you can do it. If you put your mind to it, you've got it. So just keep working hard and you'll do great things. So I'm proud to be a Richards warrior, and I hope y'all are too.
Thank you for encouraging our kids.
Absolutely.